Welcome back to the Medical Board Exam Experience with Dr. Kwafu. Most countries have their Medical Council license examination, but there are some countries that do not have Medical Council license examination. One of these countries is the United Kingdom. As of today, 3rd July 2020, there is nothing like the UK Medical Council board exams. However, there are various pathways that international medical graduates can use to practice in the United Kingdom. The most common pathway is the Professional and Linguistic Assessment Board examination, which is commonly known as the PLAB exams. From 2020, these PLAB exams will be replaced by the UK Medical Council license exams, and so the number of questions, how the scores will be, are all going to change from 2022. Now, for one to use the PLAB exams, you first have to write an English exams, which is commonly known as the IELTS. When you pass the IELTS exams with the required scores, then you can sit for the PLAB 1 exams. When you pass the PLAB 1 exams, you can go ahead and take the PLAB 2. And when you pass the PLAB 2, you can now apply for a license to practice in the UK. Dr. Praneeth Addagarla is an international medical graduate of the China Medical University in China. He has successfully passed the IELTS exams and also the PLAB 1, and he is currently preparing to take the PLAB 2 exams. He has joined us today to share with us his experience on how to study for the IELTS exams and also the PLAB 1 exams. He will also talk about how he is preparing to take the PLAB 2 exams. Let us join Dr. Praneeth. On this channel, I interview doctors who have successfully passed or failed any medical board exams to share their exam preparation experience with us and with all those preparing to write theirs. I encourage anyone watching me at this moment to kindly subscribe to this channel and also recommend this channel to any medical student or medical doctor who is preparing to write the board exams of any country. If you have experience with the board exams of any country and would like to share with us, kindly reach out to me on my Facebook page, Instagram, or leave a comment at the comment section under this video and I'll keep in touch. My first question actually is what is the PLAB exams and who is qualified to take it?
So PLAB, it is basically abbreviated as Professional and Linguistic Assessments Board, is a test that provides pathway to all the international medical graduates who want to practice in the UK. And yeah.
Okay. So if someone wants to write the PLAB exams, is he supposed to just directly register for it, or he has to do other things before he can register for the PLAB exams?
Yeah, to be eligible for writing PLAB, one has two pathways. Like he can either write, a person has to get his English verified. His level of proficiency in English would be verified. It can be done. It can be achieved by either writing the IELTS, which is International English Language Testing System, or OET, which is an Occupational English Test.
Okay.
So either of them, we need to have a basic set of scores required to be eligible for writing PLAB 1.
Okay. So which of them did you write?
I've written the IELTS,
Okay.
and people who know what IELTS is, like basically it is four sections. It has like listening, reading, writing, and speaking. And for being eligible for PLAB 1, you need to have a 7 or more in each band with an average of 7.5.
Okay. So how long did it take you to prepare for that English exams?
For IELTS, I did prepare for like 20 days.
Okay.
20 days, I think more than 20 days. More than 20 days, yeah. 3 or 4 weeks. And then I've given the exam.
Okay. Did you attend any special classes, or what books did you use?
I have my brother who's actually working in Singapore. So he used to check my English essays. Like he was the one who used to correct my English or suggest me something regarding my English. And there are plenty of plenty of materials which are available online. So
Okay.
I've used YouTube thoroughly. I've used few of the websites
Okay.
which have pretty good material. So I've used those, and
Oh,
I didn't join any coaching center or something, but yeah, I did use the material which is available online.
okay. So after passing the English test, then you register for the PLAB one, right?
Yeah. So with IELTS, you'll get a IRF number, which is required for you to put it in the GMC account. So
Okay.
basically, one has to create a British Medical Council, the GMC, which is called GMC. So you need to create British Medical Council. You need to create an account in the website, and you
Okay.
need to put in your IELTS score, which gets validated in like 1 or 2 days, and then you can apply for your PLAB one.
How long did it take you to prepare for the PLAB one?
So I was writing my exam in March of 2020. I cleared my IELTS in September. So I had like 6 months, but I didn't actually prepare for 6 months. I've prepared from December, to be honest. From December, mid December, I've started preparing. But then I didn't again study in January, because in India we have this festival we celebrate in January. So pretty much most of the January I didn't read. By the end of January again I started. So authentically, I'll say three months of solid prep. Yeah.
Okay. And did you attend any special classes or you studied by yourself?
Uh, no, I studied by myself, but I used my friends' help. Like few of us, we made a small group. We used to have Zoom sessions,
Okay.
and we used to discuss whatever we studied and that. Yeah, but I didn't attend any special coaching classes or something.
Okay. Are there specific resources or books that you use that you will recommend for someone to use?
Yeah, ideally, if I had started my prep in September, I was planning to use these two books called OHCM, which is Oxford Handbook of Clinical Medicine, and Oxford
Okay.
Handbook of Clinical Specialty or Clinical Specialities.
Okay.
But then I was short of time, so I was referring these books when I had doubts. But
Okay.
I was studying other material. But there are other materials which you can study, but these two are the standard books that one has to, so, one can use or
Okay.
one should use in.
Okay.
So yeah, those two books are the authentic gold standard books for PLAB exam. Both,
Okay.
even PLAB 1 or PLAB, those two books are the gold standard. However, there's a lot of material which is available others, which like PLABable, which is a subscription. You need
Okay.
to pay like 20 or 25 pounds for 3 or 5 months respectively. And
Okay.
it has multiple choice questions which are similar to the PLAB exam questions, and which they give a pretty good explanation of the questions as well. And that is the source that majority, like 99% of the people use it. And yeah, so that is the only source. Like most people just do that, but I had this other thing called I found this other thing on a website called PLAB One Keys.
Okay.
It is also under subscription. So it has notes which you can study and then solve the questions from Plabable, which is what I did. But whenever I had doubts, I've went to these two books which I said, like OHCM. Yes, I've referred them if I had any doubts.
Okay. So the PLAB one, the exams is in. There are how many questions? And what is the
So
time,
it
the
is,
duration for the exams?
yeah. So it is 180 questions, and the time limit is 3 hours. So broadly, like if you can see, like only 1 minute per question. You cannot spend a lot more time for one question. It's 1 minute per one question, 180 minutes.
Okay. And what is the passing score?
The passing score actually varies, but it is usually between 114 to 120. So we can say like 65 to 67%. It fluctuates, but it's 114 to 120. There's no fixed passing rate. It depends on the top candidate, like how he performs, and it's 57. It's like that. So it's
Okay.
usually 114 to 150 out of 180.
Okay. So during your preparation time, how many hours were you studying a day? What was your study schedule like?
Yeah. So I am not a person who can study for a lot of time, like not 8-10 hours at stretch. So I used to study with a lot of breaks. So I'll say like 4 to 6 hours initially, because you need to get in a lot of material. You need to get the concepts right. So 4 to 6 hours initially, but then when the exam was getting near, like in the month of March, I was sitting like 12 hours per day, or even maybe more than that, because mocks take a lot of time. I used to do mocks. So I used to do like 2 mocks per day, and then I had to revise my material. So when the exam gets near, obviously everyone will study a lot of time. So I also did the same.
Okay, so you were talking about mocks. Are there assessment questions that you can use to test yourself before the main exams?
Yeah, to get the actual simulation of an exam, Plabable, the one at the app which I told you, it has 10 mocks, so you can simulate the same exam situation. But it has repeated questions, because the basic majority of people study from Plabable, so most of the people remember the questions and solve it. But the British Medical Council, in the website itself, will have uh, 40 questions, which are pretty similar to the main exam questions.
Okay.
The same format, so you can use that. There are many other resources available online. You can find mocks online. There are so many mocks you can find online.
Okay. So the PLAB 1 consists of which subjects or which areas?
So speaking in context of the MBBS, we'll have our fourth and fifth year subjects, majority of them, internal medicine, surgery. But broadly speaking, like majority of the questions are from medicine, because we divide the PLAB content or the PLAB material into 30 subjects.
Okay.
30 subjects in the sense, like we have majority of them are internal medicine, like cardiology is a separate subject, neurology is a separate subject.
Yeah.
So majority of the medicine subjects are included. We'll also have obs and gynae, obstetrics and gynecology, pediatrics, ENT, opthal. These are the major subjects. Psychiatry is a major part of the exam. But there are also first year and second year subjects like anatomy, pharmacology, pathology, few questions from microbiology. Biochemistry, not so much. Like I've hardly seen questions from biochemistry, but anatomy and pharmacology they give a good amount of 5 or 6 questions from each.
Okay. So can the PLAB be taken in any country, or you have to go to UK to take it?
So yeah, it depends on the time you apply for it, because now, right, with the current situation, like now we are speaking in June. So for the rest of the 2020, there are no seats available in India to write the exam. Like there are 2 more attempts for September and November, but both of the slots are filled. So there's no more seats to write in India. But you can write it. You can write it in any country which is available. I think very few. Like I tried to write an exam. I tried to write it in Singapore. Tried to book a Singapore slot, but there's no Singapore center to write the exam, because my brother stays there. I tried writing it in Singapore, but there's no center in Singapore. So yeah, it depends on the time you apply it. I'd say it's better you plan everything ahead, so that you can find a slot in your country itself. So one thing that I say is UK slots remain open 1 week before the exam as well. But international slots, they get over a month and a half prior to the exam. So essentially, when I was writing in March, by Jan 30th, the March 12th was the exam, and Jan 30th was the closing date for booking your slot for international centers. But for UK centers, it was March 5th.
Okay. So if someone fails the PLAB 1, is he allowed to retake it? And how many times can one retake it?
Yeah. So yes, one can retake his PLAB exam. You can retake it. I think like 4 times, but the time becomes a major issue, because once you get your result, then as I said, the slots are getting filled very fastly. That one might not find a slot in the immediate next exam, so they might have to wait for 3 or more months than they already. So that becomes a problem. But other than that, you can just book your PLAB exam, but you need to complete it in 4 attempts.
Okay. So if you are to prepare for these exams again, the PLAB 1, what are the things that you may do different? Like, will you make some changes in your preparation?
I would have maybe did more mocks so that I could find a balance in my time management, because in the exam I had like 10 seconds left when I put my last MCQ. So I didn't have time to recheck all of the questions. So maybe I would have worked on my time management. Also, I didn't refer to I didn't study from OHCM, the two standard books which I mentioned. I didn't refer to them thoroughly as I intended. Maybe I would have started my prep earlier. Yeah.
Okay. So I know you are yet to prepare for the PLAB 2, but what do you think the PLAB 2, what areas does it cover? Does it cover the PLAB 2 exams? Which areas does it cover?
So PLAB 2, I just started it. So I just started my preparation. So I've got to know that there are three parts of the scoring PLAB 2, which is history and management and interpersonal skills.
Okay.
So majority PLAB 2 is basically an OSCE exam. So it is objective structured clinical examination. It is mostly how you interact with your patient, how you empathize with your patient, how you talk to your patient. It's more of your interpersonal skills rather than your medical knowledge. Because most people say this because PLAB 1 has already tested your medical knowledge.
Okay.
What your theoretical knowledge, what you've studied in MBBS. But PLAB 2 is all about your how are you as a doctor? How would you deal with a patient in a real situation, in a simulated situation? But they would want you to be a doctor. Like, how would you talk to a patient? How would you convey an information, or what are you expecting from the patient? How do you get your history? It's all about your interpersonal skills in PLAB 2 and communication skills. That is what is required of PLAB
2. Okay. So after taking the PLAB 2, you just apply for residency, or you have to take another exams?
No. Residency, you can start it, but within your limited period of time, depending on the department which you want to do your residency in, you need to clear your membership exams. So that is the main post-graduation exam which one has to clear. But with PLAB route, you need to do a non-training job for at least 12 months.
After the PLAB 2, you have to do a non-training job for 12 months.
12 months, yeah. But it can also be, if you have your country's license, if you're a registered doctor in your country and you already have for 6 months or 7 months of experience from your country, you can get it signed off from your consultant, and then you can do the remaining 5 months in the UK.
Okay. So after having that experience, then what is the next step?
The next step, you will apply for your so now this non-training job is called foundation year 2, FY2. So once you're done with your FY2, you can apply for CT1 jobs. CT is basically core training. It's either your medical specialty or surgical specialty. It is core medical training or core surgical training. You apply for your core training, and during your core training, depending on what type of year you need to, depending on what type of department, you need to know when do you have to complete your membership exams, so that you can enter into specialty training. So core training for I'm preparing for medicine. I'm thinking of medicine, internal medicine. So for me, it is three years of core medical training. So within those 3 years, I have to complete my membership exams. And then I'll go into specialty training.
Okay. So let's come back to the PLAB exams. Can you take PLAB 2 before PLAB 1, or you have to take the 1 before the 2?
I'm not aware of it, if you can take PLAB 2 before PLAB 1, but I don't think so. It's not like USMLEs. You need to have your PLAB 1 to sit your PLAB 2. So yeah, you can't do that. You need to have your PLAB 1 to sit for PLAB 2, but for PLAB 2, you don't require IELTS. You don't require your English language test or OET. You need to have your PLAB 1.
Oh, okay. So
someone's IELTS might have expired by the time they're writing PLAB 2, it's okay because they have their PLAB 1 results. However, PLAB 1 is also valid for only 2 years, and IELTS is also valid for only 2 years.
So, really? So you have to finish the whole process within 2 years when you start?
Yes.
Oh, okay. Wow. Okay.
Ideally, less than 2 years, because the GMC registration also requires IELTS. So, yeah. the British Medical Council registration. For the registrations or licensing, you also require IELTS. So less than 2 years, I'd say, because registration also takes a bit of time, or at least a
Okay.
month or two.
Okay. So the PLAB exams is commonly called, like people see it as a UK medical board exams. So is it only UK that you can practice after going through the PLAB exams?
Yeah, for practicing, you can only practice in the UK, but with experience of UK, you can actually go to Canada or Australia. Also, PLAB is a requirement for writing the New Zealand license exam. So the
Okay.
basic eligibility for NZREX is PLAB 1. So you need to have your PLABs to write your PLAB 1 to write New Zealand licensing exam. So yeah, this is what I know. But with UK experience that you get after your PLABs, you get your registration and you work in UK for like a year or two. You can use that experience to move to Canada or Australia.
Okay.
And, yeah, but I don't know the exact process how you can do that. But I've heard that you can move to Canada or Australia and you can use that experience.
Okay. So I want to also ask, do you know how much doctors in UK take as their salary?
So people who are working in doctors who are working in the NHS, the fixed salary which I found it in the UK website or the British Medical Council website was for FI2 post. It is like £27,000 per year.
Okay.
And then for CT, it's around £37,000 or £31,000, and it keeps on increasing like £2,000 or £3,000 per year with each year. And once you become a consultant, you'll earn somewhere between £75,000 to £1,05,000 or 1,10,000. But for private practice, I think obviously you'll earn more.
Okay.
But for the doctors who are working in UK, this is the thing I found it on the website.
Okay. So the PLAB 1, do you have to be a graduate before you take it, or in medical school and you feel you're ready, you can just register for it?
You can register for it. You can apply for your PLAB exam while you're doing your internship. You can plan yourself prior ahead, because I found this person whom I met at the exam center. So he graduated a week before the exam was, and he gave his exam a week later. So he graduated essentially on March 5th, and he gave his exam on March 12th. So I didn't know that. If I had known that, I would have also done that. I would have written my IELTS prior. I would have booked my PLABs, but I didn't do that. So I didn't have the I didn't know that, so I didn't do that. But yeah, if you plan ahead, you can actually write immediately after your graduation. Like maybe now, see per se, people in India usually graduate in April, and the next exam is in June. So they can write their IELTS in January or something and book their PLAB for June, so that they keep on preparing during their internship. And once they're done with their internship, or once they're done with the graduation, they can immediately write. In 2 months, they can write their PLAB for people in India.
Okay. So for medical students or anyone who is planning to take this PLAB journey or practice in UK, what is your advice for those people?
Yeah, for medical students who are in their third year or fourth year and they want to do PLAB, I'd ask them to study OHCM and OHCS, the standard books, Oxford Handbook of Clinical Medicine, Oxford Handbook of Clinical Specialties, because they have a lot of time to go through each subject and master the concepts. But for people who are in internship, the one thing I'd say is plan everything ahead. Like plan your IELTS when you want to write your IELTS, so that you can book your PLAB 1 and then have a clear idea when do they want to do their PLAB 2. Because now, because of Corona, we don't have. I've written my exam in March, but now I'm not going to write my PLAB 2 until I don't know when, because it's cancelled for the entire 2020. So having a plan is ideal, because if I had written the exam in November, as immediately after my graduation, maybe I graduated in July. So if I'd written it in November, by now I would have done my PLAB 2 and I would be waiting for my registration. So planning ahead is really important. I'd ask them to plan everything out and find out all the sources, like what you need to do, and have a clear idea what you want to do, like how do you want this thing to go on without wasting time.
Okay.
That is what I suggest.
Okay. So thank you very much, Dr. Praneeth, for joining us today.